Okay, so this is a lecture on cytogenetics and lymphoma. And like the other lecture on leukemia, it very much dovetails in with the pathology. So lymphoma is defined as a discrete mass arising from lymph nodes. And there are several lymphomas with specific cytogenetic changes, and these changes aid in the diagnosis of the type of lymphoma. So for instance, if the pathologist is worried about a specific lymphoma, they're going to want to look at the chromosome analysis to see if that might go along with what they're thinking. Burkitt's lymphoma is a non-Hodgkin's lymphoma first described in children in Africa who had lymphoma in addition to Epstein-Barr virus. In this picture, this swelling on the side of the face you probably see this in many of your slides. It's usually seen in children, and it's sporadic throughout the world, and there's non-lymph node tissue involved in Burkitt's as well. But in Burkitt's lymphoma, one of the genes involved is the MYC gene, which is located on the long arm of chromosome 8, and it plays an important role in protein synthesis and differentiation. And I don't expect you to memorize this slide. I'm just kind of showing you how many things MYC is involved in. It controls the cell cycle, progression, proliferation, transcription, and kinases. So in Burkitt's lymphoma, there's a rearrangement between the long arm of chromosome 8 at Q28, where the MYC gene is here, and chromosome 14 at Q32. The MYC gene is normally located, as I said, on the long arm of 8, but it's translocated onto 14, which increases MYC expression. And as I said, it's involved in a lot of things, including apoptosis, cell proliferation, and angiogenesis, another great thing that cancer loves to do, which is try to build blood vessels to its growing tumor mass. So the MYC gene is important in many disorders in cancer, but we're just talking about it in the case of Burkitt's right now. One of the things I want to talk about is the FISH probe, because when we're talking about BCR-ABL and 1517, we're talking about fusion probes that we can see the translocation because it's fusing together. But MYC is actually what we call a break-apart probe. So we have the probe for MYC, and there's two sides to it, the red and the green. And when the 8 is where it's all 8 is sitting together the way it's supposed to, that's fine. But if it translocates, then we'll see a break apart from the red and green. So let me just show you this. So here, this is a normal FISH for chromosome 8 for the MYC probe. We see two 8s, and they're fused together here. But when there's a rearrangement, one of these breaks apart, and we'll see one yellow and one red and one green. So that's the abnormal. It's actually the probe breaks apart. And there are a lot of different translocation. We talk about 814 with MYC, but there can be a lot of other like chromosomes that MYC can translocate to. Follicular lymphoma is another specific lymphoma with a cytogenetic abnormality. And again, I've chosen the ones that Path is going over just to kind of go over this a little bit. So the chromosome translocation is between 14 and 18. So it's actually the same for 14q32 to 18q21. And this leads to dysregulation of the BCL2 gene on chromosome 18. And this deregulates and decreases apoptosis. Again, apoptosis, the cell stops growing, so it stops that. 90% of patients with follicular lymphoma will have the specific translocation. So if the pathologist is worried it's follicular lymphoma, we want to worry about a 14-18 translocation. And the last one that we see a lot of specific translocations is mantle cell lymphoma. And this represents 6% in non-Hodgkin's lymphomas, and it's more common in males and females. And so here we have a translocation between 11 and 14. So we see 814, 1114, 1418. So 14 is kind of an important player here, this BCL1 gene. And this specific translocation is between 1114, again, the Q arm, and this results in overexpression of cyclin, which results in amplification of cells. So take-home points. What I want you to learn from this is basically there are specific translocations. In Burkitt's, it's 814, and the MYC break apart is the COM is the 8 as on chromosome 8. Follicular is 1418, and it deregulates BCL2. In mantle cell is 1114, and it involves the BCL1 gene. So that, again, this is kind of brief, and it's just going over the things that Path was talking about. And again, I definitely don't expect you to memorize this, but it's just kind of a colorful animation of all the different, here's the 922 and the 1517. And well, we're not talking about Ewing sarcoma or synovial sarcoma, but anyway, I just thought that was just an interesting slide, but you don't have to memorize it.